Welcome. My name is Ana Sofia De Brito, and I'm a certified nurse midwife at Women and Infants Hospital as well, right, working with Liz as part of the academic division of obstetrics and gynecology. I don't work in the outpatient setting, seeing patients as part of my own patient panel anymore, but instead I work in the emergency department, antepartum, labor and delivery, and postpartum. So if you happen to give birth at Women and Infants Hospital with the practices who deliver there, most likely we might meet. And I'm also a parent to an almost 5-year-old, and my birth story is an integral part of who I am. And birth becomes part of your story as an individual for the rest of your life, and for those you allow to enter into your space as well. And so today we are here to discuss the act of building your village, or as I would like to call it, your birth and wellness community. So some of you may just be starting to think about what this means to you, and you might be thinking along the lines of who will be at my birth? Is it my mom, my dad, my sister, or my partner, or whoever it may be? And others might have already built a robust community made of family and friends and other supplemental care givers such as doulas. And today I want us to think in the most idealistic terms about what can be our birth and wellness community. Allow yourself to imagine optimal wellness. Imagining and dreaming is radical, and it's so important for your pregnancy and your postpartum journey. So today you'll hear from our guest speakers on doula care, how to fund a doula in Rhode Island, sleep wellness in the postpartum period for yourself and your infant, as well as a tale of two births, reflecting on the differences of birth in isolation during COVID and birth in non-isolation or with support. So as a midwife, I like to think about pregnancy as a time where you are most aware of your ever-changing body. Your senses might be more sensitive. You're feeling the kicks eventually of the new and forming human in your body. Some of these are welcome changes and some are not, like nausea. And during birth, I like to think of the journey as one between the veil. So when you're in actual labor and giving birth, it's one of the only times in your life where your body is alerting you to pain, but you are safe and undergoing a normal physiologic process that simultaneously places you in a space between life and death, both figuratively and literally. That death can signify the death of you as an individual, becoming a parent, and so many other metaphors that can come from giving birth. And this can be one of the most sacred journeys that you put your body through. Although I am speaking about the gestating person as an individual, the pregnant person is nonetheless connected to their immediate family, right? So whether that's your partner or your family members and your neighborhood and the larger society. And it is incorrect to think that you are doing this alone, that you are an individual in this birth experience. And it's also incorrect to assume you should be going through this alone. So I also wanted to share a little bit about my story of becoming a parent. So before I became a parent, I was already a midwife for a couple of years and had a deeper understanding of pregnancy discomforts, labor, birth than most people, I think, who become pregnant do. But despite all my preparedness, giving birth and becoming a parent consistently surprises me still to this day, almost 5 years later. And if it weren't for my community, I wouldn't be here today, literally. And so today I'll walk you through thinking about your community and wellness by starting the discussion on who comprises your health team. Most of us find ourselves in the position of choosing our OB-GYN or obstetrician gynecologist based on the same person in clinic we saw who performed our first pap smears. We believe that this is what we have to do. We don't shop around. We ignore our own philosophies and ideas that have guided us through life. We spend more time researching and choosing a car, I think, than choosing a birth and pregnancy practitioner, which always makes me wonder where we're putting our most concerns in our life. And so choosing your birth team is an important aspect of your pregnancy and birth journey. In the United States, midwives perform right now about 10 to 12% of births in the United States of America, so all of the USA. And so it can be difficult to find a midwife based on where you are in the United States, depending on the region. But here in the Northeast, we do have a lot of midwives. And in Rhode Island, we have a robust workforce of midwives that we're increasing. And most people don't know what we do, or they have an idea of us as this crunchy, hippie herbalist practitioner who only do home birth. And although that is a facet of midwifery and can be the midwife you want, we are also, especially in the Northeast, embedded in the healthcare system as it stands. We are medical practitioners. knowledgeable not only about birth, but the reproductive system, and can be found in clinics, hospitals, and in Rhode Island, we are independent practitioners. There are certified nurse midwives, certified professional midwives, and midwives who work in various settings, home birth, birth centers, although we don't have a birth center, a standalone birth center here in Rhode Island, but we do have the alternative birth center at Women and Infants Hospital. And we have midwives in the hospitals, or those that you see in the clinic who then deliver mostly in hospitals here and around Rhode Island. And if you are wondering where, so Women and Infants, Landmark, South County, those are the three in Rhode Island that have midwives working and practicing. Kent Hospital, unfortunately, does not have any ones. And if I'm missing one, please drop it in the chat as well. And our philosophy to birth care is a holistic attempt at navigating you through the healthcare system and meeting you where you're at and attempting to protect normal physiologic birth, which is allowing your body to do what it needs to do and intervene as needed. Many people think that you can't get an epidural with midwives, and that is not true. We can help you prepare for that as well, if that's the need. And then many pregnant individuals have stated midwives spend more time with them, educating them about their bodies and pregnancy and taking care of them mentally during the postpartum period as well. And it's important to ask yourself, what is important to you? Is being heard at your prenatal visits and not being dismissed important? Is feeling educated and knowledgeable about your body and pregnancy super important? Is understanding normal so that you can know abnormal important for you? Is feeling aligned with your birth choices and not having to fight for every choice you've made or want important? Is having your partner be included in your prenatal visits and part of your care important as well? These are all questions you should not ignore as you choose your medical and birth practitioner. And if at any point your medical provider does not align with you or you feel dismissed and unheard, you have the right to dismiss them as well and find someone new, no matter where you are. It might be more difficult in the third trimester when you're 38 weeks, 39 weeks, but you can move on and find someone else who is better suited to care for you. So great. So now you have someone who will safely guide you through the physical changes of pregnancy and keep you safe and detect abnormal qualities in your pregnancy. But we have to think beyond the physical. Mental preparation for birth is an important aspect that often goes without acknowledgement. You wouldn't show up to a marathon without months of preparation and running and fortifying yourself physically and mentally for 26.2 miles, right? And that's the same thing that I ask of my patients when I was in the clinic, that we prepare while we're together for about almost 10 months. Why don't we prepare mentally for what you are to expect, what you need to know, how you're going to feel? We can't predict everything, but we can prepare mentally for this arduous labor process, right? And if we're not preparing, then why are we asking ourselves to do the same for the marathon that is labor and birth and postpartum? The United States of America healthcare system is lacking. We know that. And until that is changed and we have more holistic care for all pregnant individuals, we have to take it upon ourselves to prepare our community and wellness team. So let's start with the prenatal period. We can add physical therapists, acupuncturists, lactation consultants, nutritionists, prenatal yoga as supplements to our westernized concept of prenatal care. But we mustn't forget community. A group of pregnant people sharing their stories and going for a walk does wonders to the body and soul. And sharing our stories and our experiences helps strengthen our understanding of pregnancy, as has been done for millennia between women and pregnant individuals. We learn from one another, and nothing can replace wisdom handed down in community, not even TikTok or Instagram. Because what might work for one person on TikTok doesn't necessarily mean it's a life hack for all. And instead, we are chasing social media standards as opposed to real lived experiences. And so in this same breath, a doula can supplement your mental preparation in an increasing medical world that is lacking prenatal education. A doula is an emotional coach, not a medical practitioner, but and depending on their skills, can come with various educational opportunities to help prepare you, your partner, and family members. And luckily today we have Liz Howard, who will continue the conversation on doulas, and Melissa, who will guide you through how you can get a doula through insurance and funding. And we actually have a doula in our panelists today who can speak to you about the ins and outs of what that entails. and why having a doula allows you to focus on your bodily experience in birth and your partner to focus on their experience and ascent to parenthood instead of continuously advocating and interrupting the physiologic process to deal with the demands of a healthcare system. So a lot of times you're in the groove, you're doing the things that you need, all the things that you practice, the positions, working through your contractions, and all of a sudden you're interrupted by something that you had already stated in your birth plan that you didn't want, such as an IV, and a conversation around that. And a doula can sort of say, well, we talked about that. And not interested in putting an intravenous IV into their hands and all of that. So doulas can help navigate that system that continuously interrupts the whole physiologic process and help advocate for things that you've all already prepared for and discussed. There's a lot to discuss about pregnancy and the birth experience and postpartum. So allow that person to guide you through that. So great, the birth happened. Now what? You had a great healthcare team. Now you're a parent, or twice or thrice a parent in your home. It's the fourth trimester, and not only are you recovering physically, but the mental health aspect is of utmost importance, and we also have to take that very seriously as well. Taking care of a newborn is demanding. It's ungrateful work. Your hormones are crashing and equilibrating. You're demanding your body to make a new substance, breast milk, if you choose to breast or chest feed. You're navigating sleep deprivation, maintaining your relationships with your partner or attempting to maintain them, family and friends. There's lots of dynamic working there. People want to visit. You don't want them to visit. You want them to take care of you, but they're so focused on the baby. You may be returning to work way too soon and attempting to make sense of whether my infant should sleep through the night at 2 months old or not. And why must they wake up every 2 to 3 hours? You're sleep deprived. It's tough to think you can do this alone. So I want us to take a moment and again, utilize that imagination and radical thinking. And imagine a world where all you had to do was lay in bed and attend to the demands of an infant, because that's what they're there for. They're there to make sure that they're surviving. They need to be fed and they need to be changed, and they want cuddles and warmth and love and feeding, changing, and sleeping with them while others feed you, do your laundry, give you sleep breaks, allow you to reconnect with your partner in this ever-changing portion of your lives. And in some cultures, they do exactly that. In Eastern cultures, people who have just given birth are taken care of by the community for 40 days and 40 nights, and they must stay warm and recover. But here in our westernized world, we don't always get that. We're very much in a rat race, and we're going, and some employers probably haven't even given you time to recover before they're asking you to come back to work. Or our laws that we have don't respect the need that you are, a lactating person who needs breaks and time to get your supplies together and pump and do all of the things. It's a lot going on. And so in my own experience, I was gifted a doula at the time, since in 2019, doulas were not covered by insurance. And I declined the full spectrum doula and opted to not get a postpartum doula because in my mind, I had this. Unfortunately, I did not have this. The people I had as my team had to go back to work within 1 to 2 weeks in my postpartum period. I was alone with an infant who was gassy, didn't sleep a lot, was very hungry, cluster fed. I was sleep deprived and without anyone else to speak to. It was literally me, the infant, and the Great Baking British Show, or the Great British Baking Show, that's what it's called, on the TV as I struggled through the immediate postpartum and the postpartum period as well. And I began to develop postpartum depression severely. Luckily, I had my therapist from my pregnancy and my midwife to catch the depression through screening and get me to appropriate resources, as well as a postpartum group that I joined on a whim at 6 weeks postpartum that brought me back to life. And those women are still my WhatsApp moms group. We're still with each other. It's almost 5 years later, and we're still supporting one another. They came to my home and prepared meals and fed me so that I could sustain myself and continue to produce breast milk, which was something I really wanted to do. And I was able to do that for almost 2 years. And I did have a doula during my birth. I actually had two, as one was an apprentice, which although I didn't choose the postpartum package at the time, they did come by and check on me multiple times in the postpartum period, even though I didn't pay for that. And my therapist that I had, and the midwife and the friends who knew when to come by and take the baby on a walk or wash some dishes or throw laundry in the machine. And so without these community links, I'd have to navigate all of these changes by myself. And it was hard. And it took a while for me to bounce back from postpartum depression. I would say that it lasted for about a year. And then generalized depression and navigating parenthood and understanding all of that. And I was so grateful to have this established team of people I could lean on and share and vent and talk about all of the concerns that I was having. And being a new parent is hard. You don't know what's normal. You're always in the pediatrician office. You're always Googling. You're on Instagram scrolling in the middle of the night, 2 a.m. while you're breastfeeding. It can be very difficult, and you're getting so much noise from different things that you don't know what is real and what is not, and what you should focus on. And so, from today's guest speakers and my own story, I want you to begin thinking about your needs and the support you think you may require. Not everyone needs all of the things mentioned, but what is most important to you? Are you a person who loves sleep and knows sleep deprivation, like myself, will make you into a subhuman? Then hire that sleep consultant. Ask a friend or family member to take the baby for 2 hours so you and your partner can nap. Do you want to be able to focus on your body's needs during labor and understand what you are going through while being supported and have someone there to remind you that you are safe and secure? Then hire a doula. And luckily in Rhode Island, we were the first state to pass private and public-based insurance to cover doulas. So utilize that resource. And then think about who is in your community and how you can lean on them. We cannot do this alone, and we are not supposed to. So think about all of the things that make you who you are and what you need and who can help you with that, whether it's a meal train in the postpartum period, whether it's getting set up with a therapist now while you're pregnant or conceiving or thinking about becoming pregnant and working through what does parenthood mean to you? How do you want to be a parent? What does going through labor mean to you? How can you connect with your body? Whether it's a chiropractor or an acupuncturist that can help you with pain or discomforts that you're feeling in pregnancy. There are so many resources out there, and we're not told about them all. And so take this opportunity to really listen to what everyone is sharing today and take notes and talk with your partner if you have one, or your family members, or sister, or another person who's gone through pregnancy, and start making that plan, because this is an important part of your life. It's going to be with you for the rest of it. You're going to think back to your birth story forever. So make it a good one, and make it one that you remember with fondness and not with a lot of trauma.